Anal fistula are more painful, and anal fistula also commonly called fistula in ano. It can be seen in up to 50% of patients with abscesses. Normally the anal canal is lubricated by anal glands. When these get blocked, they form an abscess and on rupturing lead to a fistula. A fistula can be present with or without an abscess and may connect just to the skin of the buttocks near the anal opening. Anal fistula are classified into 5 types, depending on their relationship with the internal and external sphincter muscles, on where they formed, either in passageway or start and ends. There are 5 types, which are extrasphincteric fistula, suprasphincteric fistula, transsphincteric fistula, intersphincteric fistula, submucosal fistula. Many of the people suffer from structural abnormalities in the digestive organs. In certain conditions that affect your lower digestive tract or anal area may cause anal fistula. Some causes for anal fistula are colitis, Crohn's diseases, chronic diarrhea, radiation treatment for rectal cancer, and so on. The intersphincteric is the most common and the extrasphincteric is the least common. A person with an anal fistula may have pain, redness or swelling around the opening of the skin near the anus, drainage of pus from the perianal skin, irritation of the perianal skin, and sometimes rectal bleeding. Severe pain in the rectum and anus, especially when you're sitting or passing stool, and person may have fever also. A single fistula tract can potentially create many openings. Hence, if treatment is not done, one fistula can cause more complex fistula to develop. That is why it is essential to identify the symptoms which you are experiencing and opt for the treatment immediately. A careful case history with physical examination or diagnosis will likely to get to know the severity of fistula. Homeopathy works primarily on controlling the infection, which helps prevent the formation and development of abscess, and then work on the development of new tissues to close down the anal tunnel. Fistula gets cured permanently when tissues are restored and the opening is closed. Homeopathy provides this healing without any surgical measure. Medicines should be taken under the advice and diagnosis of a well-qualified homeopath. Homeopathy is the best suited method in treating anal fistula and in cases of recurrent anal abscesses which may be difficult to heal. It is also best suited in cases of post-surgical cases of anal fistula. Homeopathy is a great mode of treatment for anal fistula, and it also helps to prevent the recurrence of the problem. You can contact Dr. Sheela Homeopathic Healthcare Clinic on 9500049892 for anal fistula treatment and for definitive cure.